This is how to answer interview questions if you have never worked as a carer before. I used to get questions like, I have never worked as a carer before, I don't have experience, so I don't know what to answer. And when I ask these people if they have in any way cared for somebody, they'll be like they don't understand what I mean by caring for somebody. And I ask, have you ever in any way looked after someone in the hospital, someone who is sick, someone who was not able to do some things for themselves? And yes, they were able to remember, oh, when my father was sick, before my daddy died, I was the one, he had an accident, I was the one that was looking after him. I said, okay, that time your father had an accident, what were you doing for him? I remember someone said she used to give her bath. But I said, do you take him to the bathroom? He said no, the father cannot move, so she have to wash the dad on the bed. We call it wash or bed bath. She has to wash the dad on the bed. I say, if you want to wash your dad on the bed, how do you do it? Do you just wash one side? He said she will wash this side and she will turn the other side. Listen, all these things I'm explaining bit by bit will help you. Don't rush it, okay? Keep listening. I said, okay, apart from that, what else do you do for your dad? He said she feed the dad because he no longer feed himself. I said, if you want to feed your daddy, what position do you keep your dad? I say he will put his head up, okay, and feed the dad. I said, why do you put the head up? Say, so that the father will not choke. I said, good. I said, okay, apart from bathing your dad, giving your dad food, what else do you do for your dad? She said she helped the dad to go to the pharmacy and bring medication for the dad, and she will give it to the dad according to how the pharmacist or the doctor said. I said, what again? She said, any day they will go for checkup. She's the one that will carry her dad with driver. They will either call bus or taxi to take the dad. So I said, with all these things you mentioned, you are a carer. The only thing is that you did it in an informal setting. We in the UK and some other people in different countries, even in Nigeria, the people do it in a formal setting where we have a care home or hospital. What we do there is still what? Caring for somebody, caring for someone who was not able or who is not able to care for themselves due to illness. They were sick, they became incapacitated, they lost their they lost the ability for them to eat. They lost the ability for them to give themselves shower. They lost the ability for them to go to the toilet, that they have to remain one place. We have to put pad on them. We have to shower, give them bed, wash on the bed and all that. These are the things we do in the care home. So when you go for interview and they ask you, questions like, why do you want to become a carer? Be honest enough to tell them that you want to become a carer because you love to care. I am now going into teaching questions and answer because you love to care. I cared for my dad when my father had an accident. My father could not do anything else. I was the one that took care of my dad until he died. God rest his soul. Until he died. Look at the things I was doing for my dad. And when I came into this country, I found out I can even progress in this field because I understand my impact in my dad's life when he was sick. Listen, when you go for interview, they will give you all the time to speak. You are the one to take charge of that atmosphere, to speak to them. You are explaining about how you cared for your father. You are telling them the things you did for your dad. And this is why you want to become a carer, because you made an impact in your father's life. You were the reason your dad was eating. You were the reason your dad stayed for that long that he was able to stay. So you coming here to become a carer, you are the reason those residents will live how long they can live. You are the reason that they would eat, You are the reason that they will wash. You are the reason. I don't know if you understand. So do not say, I don't have experience. You have experience. Now, with other teachings that I'm saying, like when they will ask you about your skills, you cared for your dad, right? All those while you're caring for your father. If you don't have patience, you cannot do it. You've got other siblings, yeah? Were they able to do all the things you did? No. It was because you've got patience, you've got empathy, you got good communication skills, you have good team working skills. When I talk about communication, you were able to communicate with your dad and be able to find out if he's feeling pain or not. You were able to touch your dad, and communication is not all about talking. The way he reacted when you touch certain part of the body could tell you, oh, my father is in pain. You were a good team worker because you now communicate to the pharmacist or to the doctor to say, look at what my daddy is feeling, or look at what my father is complaining. Those things are skills. You were patient because at some point you will get angry. You want to give them medication, they will spit it out. You want to give them food, they will want to vomit it, they want to frustrate all your effort. But because you have empathy, a good skill, a strength, because you have empathy, you understand, oh, my father don't used to be like this. It is sickness. You put yourself in his shoe. If it's me, who knows how I'll be doing? So I just have to take it. I have to accept it and care for him. Are you getting my point? So when they ask you about abuse, you tell them that way you cared for your father. You did not in any way hit him for one day, no matter what. That is why if I'm teaching you, I will say it in detail. I will explain what abuse is. I will explain different types of abuse so that when they ask you, you can be able to put it in a practical form. When you were caring for your dad, did you hit your father? No. Did you call him names? No. Did you steal his money? No, because he's not able to do anything. Did you do all those things? No. Some of us even had access to our daddy or mommy's bank account, bank card. We didn't do any of those things because we didn't do them. Some of us started going to their account when they have died because we have no option than to go there. But when we did not exploit them because they were sick. So taking money from them without their consent and spending it is financial abuse. Did you do that? No. Hitting them is physical abuse. Did you do that? No. Calling them names like, look at you, you are vegetable, you can. Did you do any of those things? That is abuse they are talking about. And if for any reason somebody elsewhere or maybe any of your siblings who is not okay upstairs come to say bad words to your dad, what do? You stand for them, right? That is what we do. We stand for our residents. We stand as, we protect them. So if we see anybody trying to abuse them or do something bad to them, we stand in for them. We report them. So if you see, won't you report? You will report to maybe your mom or maybe people that you should report that thing to handle it. So do not think that because you've not worked in a formal setting that you cannot be a carer in the UK. No, you can. Use these simple scenarios that I have just said and prepare yourself. For every other things, maybe somebody had a fall or in normal common sense should tell that if somebody fall on the ground, you don't lift them up because there are so many reasons why you shouldn't. You might even break your back. You can even cause them to have more injury than they should because you are not trained on how to lift them. You need to call for help. So this video is becoming longer there. I will have to end it here. Ask me your questions under the comment section and we'll start from there. I wish you all the best. You can do it. I know you can do it. And I'm sure you will pass that interview. Good luck.